A lymphadenectomy, also known as lymph node dissection, is a surgical procedure to remove one or more lymph nodes or groups of lymph nodes, which are then evaluated for the presence of cancer. Suprahyoid lymphadenectomy. The physician makes a curved incision beginning below the ear, curving down to the top of the hyoid bone and continuing toward the chin. The tissues are dissected and the targeted structures are exposed. The submental and submandibular lymph nodes are removed along with the submandibular gland and surrounding tissues. The incision is sutured with drain if necessary. Thoracic lymphadenectomy by thoracotomy, mediastinal and regional lymphadenectomy. The physician makes a large vertical chest incision over the sternum. The tissues are dissected away, the sternum is exposed. The chest cavity is entered through the sternum, which is split and retracted. Lymph nodes near the lungs, around the heart, and behind the trachea are removed. The area is irrigated, the retractors are removed, and the incision is closed with sutures or staples. Abdominal lymphadenectomy, regional, including celiac, gastric, portal, peripancreatic, with or without para-aortic and vena caval nodes. The physician makes a midline abdominal incision. The abdominal contents are exposed, allowing the physician to locate the lymph nodes. Each lymph node grouping, with or without para-aortic and vena caval nodes, is dissected away from the surrounding tissue, nerves, and blood vessels, and removed. The incision is closed with sutures or staples. Pelvic lymphadenectomy, including external iliac, hypogastric, and obturator nodes. The physician makes a low abdominal vertical incision. The surrounding tissue, nerves, and blood vessels are dissected away, and the pelvic lymph nodes are visualized. The nodes are removed by group. The wound is closed with sutures or staples. Retroperitoneal transabdominal lymphadenectomy, extensive, including pelvic, aortic, and renal nodes. The physician makes a large midline abdominal incision. The surrounding tissue, nerves, and blood vessels are dissected away, and the lymph nodes are visualized. The nodes are removed by group. Some surrounding tissues may also be removed. The wound is closed with sutures or staples. Cervical lymphadenectomy, complete. The physician makes a large curved incision starting at the ear, going down the neck, and continuing to the chin. Incision may also be made starting at the original incision and continuing down the neck. The skin flaps are folded back and held in place with retractors. The tissue, lymph tissue, blood vessels, nerves, and muscles targeted for removal are dissected away and removed. The incision is closed with sutures. Cervical lymphadenectomy, modified radical neck dissection. This lymph removal procedure is performed to preserve the spinal accessory nerve, jugular vein, and the sternocleidomastoid muscles. The physician makes a large curved incision starting at the ear, going down the neck, and continuing to the chin. Other incisions may be made down the neck from the original incision. Skin and tissue are retracted and the physician removes the lymph nodes. The incision is closed with sutures, including wound drains connected to suction. A tracheotomy may be performed. Axillary lymphadenectomy, superficial. Complete. The physician makes a diagonal incision across the lower axilla, exposing the axillary vein. The fatty tissue, lymph nodes, and vessels beneath the vein are dissected free. A drain is placed and connected to suction. The tissue and skin is closed with sutures. Report 38,745 if a complete procedure is performed. Limited lymphadenectomy for staging, pelvic and para-aortic. Retroperitoneal, aortic and/or splenic. The physician makes a midline abdominal incision just below the navel. The surrounding tissue, nerves, and blood vessels are dissected away, and the pelvic and/or para-aortic lymph nodes are visualized. The nodes are removed. The wound is closed with sutures or staples. Report 38,564 if retroperitoneal lymphadenectomy is performed. Inguinofemoral lymphadenectomy, superficial, including Cloquet's node. In continuity with pelvic lymphadenectomy, including external iliac, hypogastric, and obturator nodes. The physician makes an incision across the groin area. The surrounding tissue, nerves, and blood vessels are dissected away, and the inguinal and femoral lymph nodes are visualized. The nodes are removed by group. The wound is closed with sutures or staples. Report 38,765 if performing pelvic lymphadenectomy concurrently. Lymphangiotomy is a surgical incision of lymphatic vessels. Lymphangiotomy or other operations on lymphatic channels. This procedure is performed to correct lymphangiomas, which are primarily found in the neck. The physician makes an incision over the site of the tumor. The tissue, muscles, nerves, and blood vessels are dissected away from the tumor. The tumor is removed. The incision is closed with sutures, wound drains are placed, and a dressing is applied.